Welcome to the Jaybefaunt channel. I am your host, JamesBFauntleroy. Yes, I am still in the hospital, as you guys can see. Yeah, I'm here. I know you guys weren't expecting me to go live, but I just wanted to update you guys on what's going on right now because some stuff happened. So, yeah, of course, it was clotted and I couldn't go to outpatient. One of the reasons why I couldn't go outpatient was because the outpatient center, they had a pipe burst, and so their entire outpatient clinic was flooded, so I couldn't go, and so I had to come to the hospital. And whenever a dialysis patient has to go to the hospital, one of the things that they have to check is the potassium levels. If your potassium levels are too high, they have to check your potassium levels and things like that before they can put you in any procedure. So um, I came in, my potassium levels were fine, but of course, interventional radiology was packed. One thing that a lot of people don't realize, and here's how I'm going to connect the class issue with the healthcare issue. Interventional radiology makes money. So, in order to make money, they have to keep interventional radiology packed. It's just like with surgeries.
Hey,
Hi,
good morning.
hi, how are you doing?
Hi, I'm Cindy. I'm the charge nurse. I was here earlier.
Mm-hmm.
I'm just doing some rounds just to kind of get a view of your care, making sure that everything's going by fine. Your nurses are the team who's taking care of you. They're answering your call bells on time. Do you have any concerns?
No, they've been actually really, really good, actually.
Oh, I'm good. That makes me happy.
Yeah, they've been really good. I really appreciate all the work that they're doing.
Okay, good.
Yeah.
The doctors are explaining everything to you.
For the most part,
Regarding your
yeah.
Okay, so
Yeah.
they're not leaving. When they come, do they come with the nurses or they come on their own?
I haven't had a doctor visit me yet in the room.
Okay, so this was I know you're still pretty new to the floor.
Yeah, so I haven't had him come yet, but
Okay. And when they did the handoff this morning, did they do it at bedside with the two nurses?
Yeah.
Okay.
Mhm.
And they included you in the conversation.
Of course.
Okay. We want to make sure that they do that so that if you have any concerns to express, you let them know.
Yeah, they were really good about that.
Okay, good.
Mm-hmm.
All right, that makes me happy. If you have any concerns, again, I'm Cindy.
Okay.
I'm going to be the charge nurse for today, and if you need me, just give me a call, okay?
All right, thank you so much.
You're welcome.
All right, I love the hat, by the way.
You.
Merry Christmas.
You too.
All right. Sorry, had an interruption there. But when it comes to certain surgeries, not the emergency ones, but I'm forgetting the name. Starts with an E. But those surgeries make money, right? It's the same thing with interventional radiology that also makes money. So they have to keep them packed. But because they're packed, then I wasn't able, because I was in an emergency situation, they couldn't take me immediately. So I had to wait till today. But in waiting till today, well, because I'm no longer NPO, which means nothing by mouth, meaning that I can actually eat, and I was starving yesterday, I was able to eat dinner. But here's the problem. I completely forgot because I had mashed potatoes with my meatloaf, right? Because meatloaf, mashed potatoes, right? I should have chose the mac and cheese instead. Why didn't I? But the meatloaf with the mashed potatoes have high potassium. Guess what happened? My potassium went up. So now it's outside of the acceptable range, which means they have to lower it before they can do any type of procedures on me in interventional radiology. Because in interventional radiology, in the hospital setting, they anesthetize you. So they do general anesthesia. When you're outpatient, they only do local anesthesia like a lidocaine to numb the area. That's it. So you're not going under at all, which means it's more uncomfortable doing it outpatient than it is doing in hospital. In hospital, it's a lot more comfortable because you get general anesthesia. But at the same time, you got to remember this. They could still do my interventional radiology without anesthesia and just do local anesthesia and still do the exact same process. But they make more money when they give you anesthesia. And their policy is you got to get anesthesia, meaning they make more money. And even though this hospital that I'm in is not for profit, they still want to make their money. By the way, the CEO of this hospital makes $5.6 million a year. And this hospital generates revenue of over $1 billion. So that's the issue. This is exactly why I talk about if profit, profit, what money making wasn't the goal, then they would have kept interventional radiology at maybe a 75% capacity. And that being said, for emergency cases that come in like myself, they would have been able to take me in immediately. They would have had me at my potassium at what was it, 4.7, which is in the acceptable range. I would have got the IR done. I would have gotten some dialysis done, a foot through the door, and I'd be home by now. But because they need to keep interventional radiology full, right? They have to keep elective surgeries pumping, right? Then to continuously make money. Then it keeps the OR full. It keeps the interventional radiology full. It keeps rapid in and out full. So guess what? Then people like me have to stay overnight. We have to be admitted, which further increases prices on more. And then because my potassium went up, well, guess what? They have to lower the potassium. So guess what? They have to charge. They have to charge for the dextrose. They have to charge on the dextrose pump as well. They have to charge for the oh my goodness, the insulin, to help lower my potassium. They have to charge for all these different things as well. So now they're charging for a hospital room. They're charging for this pump. They're charging for the medications to lower my potassium. And so then this adds to what I'm already being charged. By the way, I'm on Medicare, right? Medicare and Medicaid. Medicare covers 80% of the cost. By the way, hospitals love Medicare. You want to know why they love Medicare? Because they don't have to fight with Medicare like they do United Healthcare. They don't have to fight with. So that's basically it.
Have your other medication.
Other medication?
Yeah, the calcium gluconate. This is part of the protocol as well. I had to have pharmacy send it to me because we don't have it up here. They have to give it to me.
Okay. Is it okay that I'm live?
Oh, yeah.
Okay.
Yeah, I just wanted to let you know what I'm
Okay.
doing.
Yeah. But yeah, so that's why, because potassium is high, so that's why they have to do all these different protocols to lower it. So if it gets lowered in the acceptable range, then I get to get the procedure done.
When it gets lower.
When it gets lowered.
Not if.
When?
When lower.
Thank you.
Yes.
Thank you.
Always manifest out there.
See, this is why I told the nurse manager that I like you guys so much, because you guys are great.
Thank you. Yes.
Yeah.
So we're going to manifest all that goodness today, right?
Huh?
We're going to manifest all this goodness and positivity today so we can get you going. You can go home sooner than later.
Yeah, because I'm supposed to be doing a mutual aid event tomorrow where we're helping out the neighbors in the neighborhood. And I wanted to make sure that I'm there because,
absolutely.
So I want to get there.
Well, I'm going to try my hardest to help with that, okay?
Thank you so much.
Absolutely.
They also said my calcium was on the low side.
I'll check to see how well.
I got to look at the my chart, but that's what it looked like. It was a little bit on the lower side, but who's counting?
No, the calcium's good. It's the chloride that was a little low. It's 94, but the range is 98 to 110. So
Okay.
I think they're more concerned about your potassium, to be honest.
Yeah.
They're not really
So that's supposed to help lower it.
correct.
Cool. All right. The whole syringe?
The whole syringe. I know, right?
Okie dokie.
Yeah, you're just getting tons of stuff today. Alright, I'm gonna have to come check your sugar just to see where it's at right now.
Okay.
I'm sorry, I didn't mean to interrupt you.
Hmm?
Oh.
No. Actually, I have a channel on YouTube and
Oh.
yeah.
Okay.
So
Does that hurt at all?
Hmm?
Does this hurt at all?
no.
No. You sure? It's not good?
Well,
Yeah.
it's achy a little bit,
Okay.
but it's probably just because it's medication.
Yeah. Because it's a little thick.
Oh yeah, it feels like the dextrose,
Yeah. Okay.
and it feels warm. Now I'm feeling in my chest.
Okay.
Yeah, no, it's warm.
Okay.
It's like that's wild. Like if I was feeling cold, I'm not really cold anymore. I'm not hot, but I'm
Mhm.
not cold.
All right. Okay.
Interesting.
All right. If you got anything else, you let me know.
Yeah. Now my tongue feels warm.
That's odd.
Okay.
All right, sunshine. So I'll have her come check your sugar,
Okay.
and then we'll go from there. Okay. And then I'll come and check. Hopefully, lab will come at 11 and try your blood.
All right.
Alrighty.
All right. So cool. And yeah, that lady from phlebotomy, she was great.
I know they're amazing.
Yeah.
I mean, that's what they do all day. It's
Yeah.
blood, so
Yeah.
I love them.
Yeah.
Unlike us.
No, you guys are good. You
We try, but there's definitely the professionals.
Yeah, yeah.
All right. If you need me, please call me. But I will come and check on you in a little bit. Okay.
All right, thanks.
All right. You're
All right. So yeah, so as far as the how the hospital system works is that this is why I always talk about needing a nationalized healthcare system. Now, what's the difference between a nationalized healthcare system and a single payer healthcare system? Single payer healthcare system is basically meaning that the government will be the insurer, right? Medicare for all would be government insurance, no more private insurance, right? I mean, if there is going to be private insurance, then it would probably be for like maybe cosmetic, maybe, but I honestly would make sure that cosmetic is completely covered under a Medicare for all if I had my choice, right? If I only could choose single payer. But with government being the insurer, hospitals would continue to still be private, right? Medical device manufacturers would still be private companies. You would have nursing homes that would still be private. What's the other one? Physical therapy centers, things like that. They'll all still be private companies. And with that, they would still need to make profit. Even the non-for-profit ones still have to make essentially profit, but they wouldn't have profit at the end of the year. You know what I'm saying? And so their people at the top would still make a whole bunch of money, things like that. And so they would still be costing us a lot more than what we could be spending in a nationalized healthcare system. In a nationalized healthcare system, that means that the hospitals, the medical device manufacturers, clinics, dialysis centers, all these different things and revolving our health. The manufacturers that built the pumps like these, the manufacturers that built the MRI machines, the CT scanners, all these different things would be government owned and ran, right? Of course, we would have to get money out of politics and things like that, and the people would have to have the ultimate say and power over our healthcare system. And that's what I mean, in a system where money is no longer in politics, right? So don't get scared. You want the government to run everything? It's like a government that's actually ran by the people, not the corporations. But that being said, a nationalized healthcare system would mean that, if it costs 50 cents to make saline bags, you're not going to be charged 500, percent on a saline bag. You're not going to be charged for 50 cents to make a saline bag. You're not going to be charged, $10, $15 for that saline bag. Do you know what I mean? You'll be charged. You're not going to be charged at all, number one. But, to create that saline bag of cost 50 cents, and the workers who help make that saline bag will make a living wage instead, right? And the people who think that a nationalized healthcare system means that the doctors and nurses and people like that who work here would be slaves. They will be no more slaves than a postal worker. There will be no more slaves than people who work at the Social Security office. There will be no more slaves than the people that work in administration within the White House, or people who are working in, the Senate or House, who are working under senators, or people who work under the Department of Agriculture, or the people who work under different interior departments, or the people who work in different State Department positions. They would be no more slaves than anybody who works in any of those departments. And so they would be paid well, right, under a nationalized healthcare system. In fact, I think that they would be paid better than, especially the people who are in the lower rungs, would actually be paid better, right? For instance, the transporters and hello.
Need to check your blood sugar.
Sure thing. Has to be with this hand, because this hand is the
Yeah, I see your thing.
yeah. So I hope you don't mind. I'm actually live on my channel right now.
Oh, do you want me to come back?
No. You can do it. I will not impede on your job. Plus, my audience is nosy.
Say what?
I said they're nosy. But yeah, that's how basically a system will work. I was telling them about, my potassium levels and things like that. Some people don't know about this stuff, so I figured, why not?
What kind of channel do you have?
Well, I talk about, politics, geopolitics, local, domestic politics, things like that. I cover things like also like healthcare too. Yeah, so.
So they're watching your journey while you're in the hospital.
Yeah, yeah.
Which finger? Anyone?
Yeah, just surprise me.
Okay.
Well, don't surprise me, but surprise me.
And a quick stick.
Yep.
There you go. Good job. Right, just apply some pressure here for a second. It's 92.
Oh, 92, not bad. For just getting a huge pump of glucose.
You did. You just got glucose.
Hmm?
You just got glucose.
Yeah, I got glucose. So for it being 92 after I just got glucose is pretty good. Definitely not diabetic, thank goodness.
That's a good thing.
Yeah.
We don't want to be diabetic. Okay.
Mm-hmm.
I'll update your nurse with this info and I'll come back and check on you. Do you need anything right now?
No, you're good.
Okay, let me take that for you.
Mm-hmm. Oh, thank you.
You're welcome. This is straight.
So
What?
just got my blood sugar taken. And so as far as back to what I was saying about a nationalized healthcare system, then it would also cost us a lot less money because then number one, the need for profit is not there. Number two, everything is built in-house, so therefore you do not have to pay other companies to build. Like for instance, I think Philips makes a lot of like MRI machines and things like that. Then if we're making it in-house, then you don't have to pay for Philips to make profit. And then all that money that would go for profit actually is circulated back to the people who are the transporters, the people who do housekeeping in the hospital, right? Because number one, you're going to need transporters to transport the patients around the hospital. And these are typically some of the lowest paid people in the hospital. You have housekeeping, who's also some of the lowest paid people in the hospital, even though they're some of the most foundational workers in the hospital. These are the people who literally keep infections down, that clean the hospital rooms, from ER rooms to they're the ones that keep clean, the standard hospital rooms, many different types of parts of the facilities. And then, you have people who are in nutrition, who are the cooks, the chefs, you know. And so these are some of the most foundational people. Like if they do not work today, the hospital essentially it can still run, but it will be a hell of a lot less efficient, right? And then of course, you have the techs, the nursing assistants. Without them, it would make it a whole lot harder on the nurses. And then if you don't have the nurses, then the doctors, then they're swamped. So this is why the foundational workers, the people who are on the lower rungs, are, in my opinion, are the ones that need to be paid a hell of a lot more than what they're being paid now. And so, of course, in my opinion, in the nationalized healthcare system, they'll be paid a better wage, a more living or thriving wage, in order to be able to take care of it, because without them, the hospitals don't run. And so a nationalized healthcare system is absolutely necessary, because then because I think it was back in 1975, I think between 1975 and 2005, 1975, we had 1.5 million hospital beds. In 2005, I think, or was it 2009? I think it was. Then we had dropped down to just over 970,000 beds, hospital beds in the United States. How is it that we had 230 million people in the United States, over 100 million people less than what we have now, but we have more hospital beds? But now we're 100 million people greater in population, and yet we're less in hospital beds. Profit. That's why. If we had a nationalized healthcare system, our hospital beds will actually increase more than what it is now. I would say that we probably need to have probably close to 2 million hospital beds. Actually, I think we should have 1% of the population. I think we should have 3.3 million hospital beds for the entire population. And then on top of that, we wouldn't need to have as many elective surgeries to be done in order to keep things going, meaning that we can focus more on preventative care, which means that we wouldn't have as many elective surgeries that's needed, which means that we would be able to treat cancer and do early prevention so that we wouldn't have to do elective surgeries, right? Meaning that we can catch if somebody is in the process of having an organ failure, we can catch it early so that it doesn't get to that, meaning less need for transplants and bypasses and all these different things. So ultimately, a nationalized healthcare system would save us money in the long run, and it would save lives in the long run. And so this is why when I talk about these things, people look at me like I'm crazy, but I'm like, a for-profit healthcare system means that you need to be sick in order for them to make profit. That's the way it operates. And in a system where you being healthy saves money, which would be a nationalized healthcare system, then it would be more incumbent upon them to make sure that preventative care is paramount. This is why Cuba focused so much on preventative care. This is why Cuba has a system where they have neighborhood dietitians. Neighborhood dietitians, meaning that the dietitians that they got there, they check on you, they talk about the food that you should and shouldn't have, what you're more predisposed to. And so these neighborhood dietitians are in there and making sure that you're good. In my fantasy nationalized healthcare system, gyms would also be included under that neighborhood in that nationalized healthcare system. And there will be dietitians at these gyms and dietitians that would make house calls and let you know, hey, you have a predisposition to diabetes. This is the type of diet that you need to have. And then trainers would be hired within that nationalized healthcare system. And then the trainers would say, look, this is the type, like you have this predisposition to obesity. So for you, I would focus more heavily on cardio, right? In these areas, because this is what I see it be best for you. And then on top of that, mental health, everybody, no matter who you are, would get a regular mental health check every 6 months. Because you never know what you could just be going through a bad breakup. That could still have a effect on your mental health. Because if your mental health isn't good, then guess what? You also affect other people within your life. And then that can have an effect on other people's mental health. And that can also affect people's trauma, have trauma. Maybe a freak accident happens. Maybe nobody's fault. It could be lightning has struck you. But then that trauma of you getting struck by lightning, you could, in your mental health, affect somebody else. Or you had a family member that died. That could still be traumatic. And then that could be carried over into people, into your kids, into your families. But can you focus on that mental health if you can't afford it? And so this is why I say nationalized healthcare system and NHS style would be much better for us than even a single payer. Because number one, it would save us money. And number two, you wouldn't have to worry about needing to afford it. It's just like in the movie John Q, sick, help, sick, help. And that's why I think it's so important, but yeah, so it's good to see all of you guys. I wonder if I can display the. I wonder if I can display it. Um, can I display people's comments? I don't know. Um, I hope so. I don't know. But anyways, thank you so much to the Taco Kid from Alamo Town. Says wishing you best, JB. Thank you so much. Eric Gray, how you doing? Says wishing you well, homie. Thank you so very much. Desert Mantis says I send you a plate loads of good medicine. Thank you so much. Raziel the Great says good morning, JB. How are you doing in there? I'm doing all right. I can't wait to get this procedure done. If I can get this procedure done, then that'd be great. So then I can eat finally and then get my dialysis and then go home. So hopefully I can do that. Xavier says, wishing you a quick recovery from India. Whoa, India, nice. Thank you so very much. Thank you. How did you find my channel? I'm just curious. Um, I appreciate if like whatever state you're from or whatever country you're from, let me know in the comments and let me know where you're from so I can shout you out. Thank you so very much. Even if you're from Orlando, Florida, like me, it doesn't matter. Let me know. Raziel says trying to charge you for the air in there. I mean, they do have oxygen. So, Tim says, I hope they get you going soon, that you don't have to stay there all day. Yeah, I'm trying to make that solidarity hub tomorrow, man. I want to do some mutual aid. Um, yeah. The Taco Kid says, Johnny Chingas, hey there. Oh, okay. Say hello to everybody. And yeah, please, thank you. I would like for you guys to share. I know I'm definitely heavily suppressed on YouTube. They definitely do that to me. Um, yeah, the system is definitely a racket, Desert Mantis. I'm trying to catch up. Waba Cohen says, JB alive. Yes, I'm alive. Thank you so very much. Yes, I am doing well. And yes, the CEO story. Oh yeah. The CEO, I mean Brian Thompson, the CEO of United Healthcare, who was gunned down in New York by allegedly Luigi Mangione, um, who is now being charged with terrorism uh, charges, not just by the state of New York, but also by the Department of Justice. Which I find it ironic how Luigi Mangione um, gunned down Brian Thompson and he's being charged with terrorism, which is funny to me. Um, because all of those mass shooters who gunned down people, especially like Dylan Roof, who gunned down a bunch of black people in the church, wasn't charged with terrorism charges. Has the KKK ever been listed as a terrorist group in the United States? Okay. But yet Luigi Mangione is being, he's being charged with that. And the funny thing is that if you ask most, just any red-blooded American who has to deal with the healthcare system in this country, if Luigi Mangione were standing in front of them right now, would they be scared or terrified? They'd say no. But we get terrified whenever we have to put in a claim for, private health insurance. It's funny. As a Medicare recipient, I'm not afraid of being denied my care because I got Medicare. Makes you think, huh? I don't get denied. I don't ever hear about denials. Like Medicare just says yes to everything that the doctor recommends. You see why I say we need a nationalized healthcare system, right? Like, yeah, single payer is a step in the right direction, no doubt. But a nationalized healthcare system, there would be no need for prior authorizations because it would basically be the doctors concur, like, yeah, let's just do this standard of care. Okay, get it done. You don't need authorizations for this type of stuff because the authorizations are really for billing purposes. Well, if there's no more billing, you see now, if there's no more billing, if there's no more need for profit, there we go. That's why. But yeah, Luigi Mangione, I do not agree that he should be charged with that because number one, he allegedly gunned down one person and it was a civilian. For doing their job of denying healthcare, which resulted in the deaths of other people. I see it no differently than I see. It's really just a killer on killer crime. It's just homicide. That's it. There's no terrorist act that I can see that I can tell from. But this is a way to put Luigi Mangione on death row. Because in New York, they don't have the death penalty. And also, this is a way to send a signal to the populace, the larger group of us, 330 million people. And it's also because we're not the ones that are terrified, us of the regular public, it's the top 1% that's terrified because of our reaction, our collective reaction. But here's the thing. Everybody goes, so you guys need to go through the proper channels. People like Chris Cuomo was saying that you guys need to go through the proper channels. Chris Cuomo, where were you in 2021 when in 50 cities we did the marches for Medicare for all? I know those of us at RBN, we went to the marches for Medicare for all. Yeah, I spoke at it. We literally marched. The only member of the squad that actually showed up was Cori Bush, and she showed up to tell us that she really didn't, that her and the squad and the progressives didn't really approve of us marching for Medicare for all, even though that's what they ran on. Okay. They basically sabotaged Bernie Sanders from winning both times in 2016 and in 2020. And then Joe Biden even said that if Medicare for all passed in the House and the Senate and reached his desk, he said he would veto the bill. So I'll be honest with you, Brian Thompson's life, his blood is on the hands of the squad, of the Progressive Caucus, on Joe Biden. Brian Thompson's blood is actually on their hands. Because if we actually got a single payer healthcare system, if these people actually listened to us and we got that, Brian Thompson would still be alive today. It was chickens coming home to roost. That's the issue. It is their fault. It is also the Republicans' fault because they should have the wherewithal to know that their supporters, a lot of them supported Bernie Sanders, a lot of them supported Medicare for all. So I also blame Donald Trump and the Republicans as well. It's not just one party, it's both parties. They're the reason why that this system is in the way it is in. They're the reason why this system is in the shape that it's in. Because they're in bed with the United Healthcare CEOs. They're in bed with Aetna. They're in bed with Blue Cross, Blue Shield. They're in bed with Cigna. They're in bed with all these hospitals, the for-profit hospitals and the not-for-profit hospitals. They're in bed with them. And so, of course, they want to keep, even the people who run the nursing homes. Luigi Mangioni's family owns the nursing homes, some of the nursing homes. And so I blame them for Brian Thompson's death as well. They play a part in this. Because if Luigi didn't have to deal with this, allegedly didn't have to deal with all these things, then he wouldn't have done what he did. If they didn't have to deal with a for-profit healthcare system that denies care, Brian Thompson would still be alive. Now, of course, he wouldn't be making the millions of dollars that he had made, but he still have his life. They put people in this position. They put people in a desperate position. And when desperation gets too high, guess what? People do bad things. So ultimately, I blame the politicians. And you know who else I blame? I also blame some of independent media too. I blame the corporate media and some of you in independent media. I'm going to call out names. You know what? Fuck it. I'm in the hospital. I'm going to call out names. Majority Report, Sam Cedar, Emma Vigilant, TYT. You guys could have talked about the marches for Medicare for all. Some of you guys who were denial about the forced to vote, some of y'all, yeah. The only person who had a big channel in independent media that actually mentioned the marches for Medicare for all, surprisingly, was Kyle Kalinske. He gets a pass on that part. He gets a pass because he also supported forced to vote. He gets a bit of a pass. But you also supported Joe Biden as well. So therefore, you got to get a little bit of smoke, right? Crystal Ball, you didn't mention the marches for Medicare for all, right? Even though you did support forced to vote, you didn't mention it, even though they reached out to you, right? Mike Figueredo, Humanist Report, you didn't mention the marches for Medicare for all, even though I think you did support the forced to vote at first, but you didn't mention the marches for Medicare for all. They reached out to you. David Dole, you have universal health care where you're at for the most part, but Sam Cedar, my God, dude, you were against forced to vote and you never mentioned the marches for Medicare for all. Ben Dixon, where were you at? Like all of y'all were sitting there, and now that the healthcare CEO got shot, now you guys want to talk about it. Now you guys want to talk about the healthcare crisis again. Now you guys are talking about the healthcare crisis and then telling people to subscribe to your Patreon. Now you're getting clicks when you're talking about it. You're getting views when you talk about it. Meanwhile, those of us at RBN, Indie News Network, Heartlands Media, Nico House, you have a lot of other smaller independent left channels. We were talking about this stuff. We never stopped. We never stopped. And we're getting suppressed left and right. Savvy Sabs. We never stopped talking about it. You know, the political matrix. Marcus and Chris, what's up? They never stopped. We never stopped talking about it, man. You know, Ron Pacone never stopped talking about it. You know, shout out to Mark. Ron. Shout out to all these people who never stopped talking about it, who kept talking about it, who kept hammering home about it, who talked about the marches for Medicare for all, even though we're heavily suppressed, even though we may have 5, 6, 7 people watching us live. But we talked about it. We never took our foot off the gas because we realized that that's what's important. The question is, what matters? Does the money or the mission matter most? For us, it's the mission that matters. And the thing is like, and I'm not that type of person that tries to be controversial and call people out. But at some point, you gotta say that, look, are you forgetting? You know, and when people are actually doing the work on the ground, the part that's not sexy, are you upholding people who are literally doing the work on the ground, who are trying to mobilize? The people who actually organized whole Washington, how many people were trying to have them on? People like Jason Call, right? People like Andre Stackhouse. All the people from whole Washington. I'm blanking on names, and I forget some of you guys' names, and I apologize. But they were literally trying to start, at least on a state-by-state basis, to get single-payer health care in their individual states. Shout out to Roger Meadows, who's trying to do the work of getting people to at least get a ballot measure, a ballot initiative in ballot initiative states to get us single-payer health care. They're trying to do it, and he's trying to do it in New York. At least something so that it takes the harm off of workers while we push for a revolution. You know, while we try to educate people about the systems of capitalism so that people aren't harmed, the working people aren't harmed. Problem is that you got these same people who I mentioned who, you know, oh, and David Pakman. Don't get me started on David Pakman. He's one of the worst. I'm sorry. Mr. Reformist trying to work within the Democratic Party, even though they screw us time and time again. You can get an audience with Kamala Harris, but you won't mention the marches for Medicare for all. You won't mention, you won't fight for third parties that are actually for single-payer healthcare system. And yes, I'm saying this while I'm in the hospital. The hell with it. I don't care. Because the thing is like what's right is right and what's wrong is wrong. And I'm sick and tired of, keeping my mouth shut and trying to be amicable when you got people that are trying to lead people down this to this graveyard that is only electoral politics. Yeah, good. Yeah, I'm good. Thank you so much. It's a graveyard. And that's the issue. And really, let's be real. We live in a capitalist system, and part of being a commentator or a pundit is making your money off of the angst and anger of people and talking about the problems. And then you offer a solution that keeps you in a feedback loop so that you keep just, oh, well, the problem is the Democrats haven't gotten us, where we need to, but we just got to keep staying with them. And then when the disappointment comes, then it's, oh, I'm going to critique the Democrats. But then when they get a win, then it's like, oh, look, the Democrats are doing this, but Republicans are stopping them. Subscribe to my Patreon so we can do better in pushing the Democrats. Getting you guys to pay for their Patreons. Even though it's like not leading you in a path that actually is going to help. This is why it's more advantageous for you guys to do the things that we say, which is build mutual aid, organize with your locally with your community, get out in these streets, leave the duopoly, leave both parties. It's not the sexy thing, man. It's not. It's not the most glamorous thing. But it will give you results. That's the point. I'm trying to do the work of making it so that we don't have much to talk about anymore as pundits on the left. Or if we do, it's not to drive a solution. I want the solution to already be here. Or if we do have to drive a solution, it's something different than what we have to do. We have to deal with right now. It's not having to fight for people to be able to just have their basic rights of healthcare, housing, education, living wage. Trying to stop these wars because the wars are based on trying to extract resources from other countries, out of greed for big corporations. I didn't mean to go on this rant, but it's like once you start to see all the things connect, you can't help but to make that connection, Anyway, sorry. D Taco, I went from talking about the healthcare story to talking about independent media. This is a hospital gown, and yes, I ain't got nothing on underneath. Sorry. Traveler's Wolf got an Egyptian Transylvania thing going on with the chamas. No, I'm not a vampire. Zach Davis says, James, how are you, my friend? Yeah, I'm still in the hospital dealing with this. Got to get this clot worked on. There's a clot in my dialysis axis in my arm, so you guys know. Yeah, YouTube only shows 5 chat comments at a time. That's weird. Plum Dum says people can't conceive of a government that isn't trying to kill you, and I don't blame them. That's true because the government started out that way. Just ask the Native Americans. That's why a complete change of the system is absolutely necessary. It has to turn from a system that started off with genocide to a system that starts off with saving and preserving life. That's how it has to start off, because how you start off is more than likely how you'll finish. And starting off with trying to save the lives and making sure people have adequate health care, housing, education, peace, liberation. If you try to start off a country that way, then that will be the culture that it embodies. You have to have a culture that embodies liberation and taking care of each other. Egalitarianism. That will be the culture that we need to foster. And that's what I'm hoping for. Traveler Soul says the government doesn't even run the New York Marathon. No, not at all. It won't let me proceed further. Oh wait. All messages. Okay, I had to switch it because it was giving me chat filter. That's why. Okay. So that's why I missed out. Okay. Let me move down. Sorry, guys. I'm not diabetic, Tropos Wolf. Brian Biondillo says, I hope you recover well and stay strong. And spot on regarding nationalizing healthcare. It's a demonic act to make for-profit industry out of a human right such as healthcare. Agreed. Tim says, you do realize in places like Canada, you can't even get vitamin D in the winter unless you get approval by the government. The thing is that you can't get vitamin D here. You can't get a shot here unless that's approved by your private health insurance. And it has to be medically necessary, right? So, the funny thing is, here's the thing. A lot of times people go, oh my God, you want the government? And it's like, hang on. Government is a tool. Government is a tool like a hammer. It's about who wields it, not the fact that it's government. See what I mean? A knife can be a tool or a knife can be a weapon. Which one do you use it for? Right? If I want to be safe, I'm going to use the knife as a tool. So I'm going to use it to cut. I'm going to use it to cut vegetables. I'm going to use it to cut fruit. I may use it to cut wood. I may use it as to cut wood for survival. I can use the knife to cut some meat. I can use the knife, to cut pieces in order to build something. Or you can use it as a weapon, right? It depends on how it's used and who's using it, right? If I give an axe to an axe murderer, that's bad. But if I give an axe to, somebody who can, use wood to build to a carpenter, and then it'll be used to build. It depends on who's wielding it. The problem is that government is in the hands of corporations. And so, of course, they're going to limit what you can have. Remember, Canada is a capitalist government. And so even though they have universal health care, it's universal health care that's operated under capitalism. And so that government implements and lets capitalism reign supreme. You literally have the UK that has a nationalized healthcare system within a capitalist government, and it's far miles away better than we have. Imagine if you got rid of the capitalist system entirely without a government being sanctioned to hell. You understand what I mean? Even in capitalism, a nationalized healthcare system is miles and away better than what we have. Caden says it's healthcare, not health cure. You won't be returning patient or customer is your cured. What? Look, in a for-profit system, there's no money in curing because you need patients. You need to treat symptoms in order to be able to continuously make money. So there's no profit incentive to cure something because that means you are literally getting rid of patients. That's how it works. In a system where you don't have profits, then the incentive is to make sure that people are as cured as often as possible. Sabita, I'm doing okay. I'm hungry though. I am really hungry. Thank you, Casey. Thank you. I'm trying. Casey said I'm in Florida too. Dad just left the hospital here in Sarasota, but his doctors kept delaying procedures he needed until he finally fell and couldn't breathe. The hospital helped a lot once he went. Oh my gosh. Yeah, okay. And this is also true, Caden says that's why they don't want the public option neither, because everyone would obviously opt into Medicare. True, because Medicare would actually work out better for the people. Good to see you, Terry. Serena says, greetings, comrades. Hope you feel better. Thank you very much. Kate Mack, I'm doing all right. I'm hungry. Social emotional learning with Dr. Donnie. JB. Dr. Donnie. Donnie King says, Kyle is worth $30 million. He is married to a millionaire. Her name is Crystal. Also, his mom. I'm not going to comment on that, Donnie King. Thank you for making me laugh, though. I live in Europe. We don't have this problem with our healthcare. It's run by government like it should be. We all pay in it. When we need to go to the doctors or a hospital, it is no problem. Thank you very much for that anecdotal evidence, Donnie. Appreciate it. And factual evidence. Thank you. Mouse, good to see you. Trauma Queen. Oh, I love you too. Thank you so much. SCH says, like the video. It's good to see you live, and maybe you should rest more. It's not, that's not even an issue. It's like, look, it's just a clot. That's it. And I'm just waiting for my potassium to go down And then once my potassium goes down, I can go get this declotted. And then once it's declotted, I can go to dialysis. And then once I go to dialysis, then I'll need to rest. But then I can just go home because this declotted. And then I go back to dialysis on Monday. So, yeah, that's it. Yeah, it's more simple than it is. Just being a dialysis patient, having a chronic illness, you need to go to the hospital. Man, there's a lot of light behind me. Is that too bright, guys? Let me know, because I'm looking kind of holy. Waba Cohen, thank you so much, says JB. I hope you recover soon. Good health. Thank you so very much. I wonder if I can show. I keep wondering if I can show comments on the screen, but I guess I can't. I'm not on StreamYard, so. CBC voter, good to see you. Tim says the reason for the Constitution is to limit the government and let the people control their lives. What does limiting the government mean, right? Because I thought government was also supposed to help people. It was a means to protect people as well, right? Like, for instance, you got consumer protection, you got different regulations that help protect people. And the thing is, like, it's supposed to protect the rights to things like privacy as well, because you don't want different companies running amok, getting all of our information, right? So I think that you have to it has to walk a fine line. But this whole smaller government argument, I think that's a fine line. Because it's like, where's the limit? Like, if you shrink government, right? Where's the limit? I don't know. I think you need a government in a modern society in order to be able to make sure that people are taken care of. Like, the trains have to run on time, and people need to have protections, you know? Travelers Wolf, China has smaller government. They're all about 4 foot. You guys are funny. But yeah, so it's an interesting day, to say the least. So hopefully I will get this thing fixed. Hopefully, let me see, it's almost 10 now. Oh no, it's almost 11. Wait, is it almost 11? Hold on. Oh, snap. That means it's almost time for me to get my blood drawn to see if my my potassium is high. My potassium is still high. I don't know. And if it's in the acceptable range, then I can just get my sorry, I'm just looking at this. What's cool is that the hospitals give us tablets as patients to see all of our information. And so we can look in our information and see all these different things. Like, you can literally look at your test results and vitals and stuff like that. It went down some already. Okay. I'm almost there just with that. So I think I'm going to make it, because potassium was 5. Because when they took it last night, or really early this morning, it was 6.2, which is out of the range. You need to have between, I think it's 3.2 and 5.2, and it's at 5.4 right now. And that was at around 9 o'clock. So I also just got something to help lower it after that. So I'm probably within the acceptable range now, which means that I probably can still get the procedure done. And then once the procedure's done, it's smooth sailing from there. Just get the dialysis done and then lock me out of the hospital. That'll be great. That'll be great. Oh, yay, this is nice. Okay. Can't wait to tell the nurse and be like, hey, take a look. But anyways, this is really cool. So let me share this with you guys. So hospitals now, they give you a tablet, and you can take a look at things like actually, let me turn the camera around. So you can look at things like, I don't care if you guys see my numbers. And yes, I have low blood pressure. I don't care. Well, I care. It's just, I'm asymptomatic, so it doesn't matter. But yeah, so you can look at all your numbers from like lab results and stuff like that, right? Then you can look at messages, and you can message like everybody on the care team. You can message all the doctors on the care team. You can message your nursing staff, everybody, right? Also, you can see all your documents. You can make requests. Requests is kind of interesting. Let me see. So then, it's things like assistance, getting back into bed. If you want to do different things, if you want to eat, you need, different services and things like that while you're in there. It's cleaning. You can request food, stuff like that, right? Something to drink, ice chips, visitation, entertainment, comfort, stuff like that. All this stuff, right? Which is pretty cool. And then you also have a schedule, like all the things that you're going to do, your medications and stuff, like when you're supposed to take your medications. And then another thing is the Just for Fun, which is cool. Just for Fun is you got access to all these things. You got, video streaming, you got YouTube, you got Facebook on here, you can Skype people. I also like to do the, I typically do the word search myself, and of course this is a religious hospital, so they have the Bible in here if you want to, but yeah, they got all this, interesting stuff, right? So it's pretty cool, and then you can also do video visits if you want family, to see you. So this is technology now in modern hospitals. So that's one thing I actually do like about the hospital. And then you can also look at exactly who's on your care team, like who's your attending physician, who's your, like for me, it's like who's my nephrologist and all this other different stuff. So Travelers Wolf, I'm not reading that. I am not reading that, Travelers Wolf. You about to get me in trouble? Travelers Wolf will get me drunk and confess the things. Casey says you're over here about to HIPAA violate yourself. Hungry HIPAA. Sorry. All right, I'm boring you guys. I'm rambling on, but I just wanted to talk about that with you guys, and I hope you guys, have a great day. And I just want to thank you guys for all the well wishes and all the love. And even if even if we disagree on some things, policy wise, it's all love here. And I just wanted to say that, I appreciate you guys. You guys are, you know, keeping me, um, keeping me, in your thoughts and holding me down. So I appreciate, you guys. So I hope you guys, have a great day. It's cold out there. Enjoy it. Get some hot cocoa. Get some hot cocoa. Get yourself some cookies or something. Make some homemade chili or something. You know, just enjoy yourself if you can. All right. All right. So everybody, take care. Like I always say, water your plants, water yourselves, leave the world better than you found it. Do all the things if you got them, and do them in a healthy way. Mwah, forehead kisses to all every single one of you. I'll see you guys in the next one, and hopefully I'll see you guys this Tuesday. Well, wait, am I gonna be streaming on Tuesday? This Christmas Eve. You guys want me to stream on Tuesday? Let me know. Because I'm thinking about it. I'm thinking about streaming this Tuesday. Jerry says yes. Because if I stream on Tuesday, I can just do I can do maybe like one or two news stories, but then just do like a Q&A and hang out. I could probably do something like that. Travelers Wolf says, why not? But are you guys going to be there though? Because, or maybe I can go live at a later time instead of doing. Oh, by the way, I wanted to ask you guys. I've been thinking about this. Should I keep my regular time on Tuesdays at 2, or should I go later? I was thinking Tuesday at 3. Instead of Tuesdays at 2, I do Tuesdays at 3. And then, of course, because wouldn't it be easier for you guys to see? Because I know some of you guys are at work. Travelers Wolf, I am not reading that comment. Don't you get me in trouble. You know how my brain works. Let a brother know, because and let me know in the comments after I end the stream if you guys are thinking about, because I'm thinking about starting off 2025 on Tuesdays at 3, because it'll be easier for you guys to be able to catch me, because some of y'all are probably at work and probably won't be able to catch me until a little bit later. And if at least I make it an hour later, then you guys be able to catch me from the beginning. I don't know. I'm just thinking out loud. Yeah, just let me know in the chat, in the comments. But I'm thinking about just for Christmas Eve, really, and New Year's Eve, that I'll probably start later, a little bit later in the day. Plus a lot of people aren't going to be streaming that day because it's Christmas Eve. You know what I mean? And so I'm thinking about it. But yeah, let me know in the chats, and let me know in the comments afterwards, so that I can adjust accordingly. Thank you, Kaden. I appreciate that. But yeah, you guys get a second forehead kiss. Mwah. Thank you so much. All right, I'm on my head out, and I will see you guys later. I'll try to give you guys an update in the in the community section. And yeah, love you guys. Thank you so much. Bye-bye.